Hello, my name is Jessica Perez, and for my Contemporary Health Issues project, I decided to do depression as a mental illness. What is depression? Depression is a state of low mood and aversion to activity that can affect a person's thoughts, behavior, feelings, and sense of well-being. People with a depressed mood can feel sad, anxious, empty, hopelessness, helplessness, worthlessness, guilt, irritable, ashamed, or restlessness. Thesis statement. The severity of depression has increased dramatically within our society. Individuals, such as athletes, are falling victim to depression. Athletes are some of the healthiest people in our society, yet they suffer from depression. The reason being is depression is a mental illness that requires treatment in order to manage and control, and the fact that depression does not discriminate. Depression does not care if you are young, old, healthy, or sick. It will affect anybody. The main issues. Common mental disorders, starting with anxiety. Disorders are characterized by excessive fear or anxiety that is difficult to control and negatively and substantially impacts daily functioning. Attention deficit hyperactivity disorder, which is ADHD, is defined by a persistent pattern of inattention or hyperactivity impulse behavior. Bipolar and related disorders. People with bipolar are related disorders experience atypical dramatic swings in moods and activity levels that go from periods of feeling intensely happy, irritable, and impulsive to periods of intensely sadness and feelings of hopelessness. Depressive disorders. Depressive disorders are among the most common mental health disorders in the U.S. They are characterized by a sad, hopelessness, empty, irritable mood and somatic and cognitive changes that significantly interfere with daily life. Disruptive impulse control and conduct disorders. This class of disorders is characterized by problems with self-control and emotions of behaviors that violate the rights of others and or bring persons into conflict with social norms or authority figures. Obsessive-compulsive disorder, OCD, is defined by presence of persistent thoughts, urges, or images that are intrusive and unwanted, which are obsessions, or repetitive and ritualistic behaviors that a person feels are necessary in order to control obsession compulsions. Schizophrenia spectrum and other psychiatric disorders. Schizophrenia is a brain disorder that impacts the way a person thinks, often described as a thought disorder, and is characterized by a range of cognitive, behavioral, and emotional experiences that can include delusions, hallucinations, disorganized thinking, and glossy, disorganized, or abnormal motor behavior. Trauma and stress-related disorders. The defining characteristic of trauma and a stress-related disorder is previous exposure to a traumatic or stressful event. PTSD is characterized as the development of debilitating symptoms following exposure to a traumatic or dangerous event. Moving over to major depression and personality disorders. Major depression is defined as having a depressed mood for most of the day and marked loss of interest or pleasure among other symptoms present nearly every day for at least a 2-week period. Personality disorders are a class of mental disorders characterized by enduring maladaptive patterns of behavior, cognition, and inner experience inhibited across many contexts and deviating markedly from those accepted by the individual's culture. This shows how depression is considered a mental illness versus just an illness. It is something that has to be worked with in everyday life. It can't just be fixed with one quick shot or one quick dose of medication. It is something that requires constant treatment, and just like any other thing like anxiety disorder, bipolar, schizophrenia, it's something that it's a constant battle in daily life. Potential impact on health and wellness. Who is affected by depression? Major depressive disorder affects approximately 14.8 million American adults, or about 6.7% of the U.S. population. Notice that it doesn't say it doesn't affect adults, young adolescents, youth, sick, elderly. It affects everybody. It does not discriminate. Depression often co-occurs with other illnesses and medical conditions. Cancer. 25% of cancer patients experience depression. Strokes. 10 to 27% of post-stroke patients experience depression. Heart attack, 1 in 3 heart attack survivors experience depression. HIV, 1 in 3 HIV patients experience depression. Parkinson's disease, 50% of Parkinson's disease experienced patients, many experience depression. Eating disorders, 50 to 75% of eating disorder patients experience depression, and so on and so forth. And going back to heart attacks, my grandmother was just recently diagnosed with depression, and she has diabetes. And her sister just recently had a heart attack, and she has just been diagnosed with depression as well. Depression and the elderly. About 6 million people are affected by late life depression, and 15 to 20% of U.S. families are caring for an older relative. A survey of these adults caregivers found that 58% showed clinically significant depressive symptoms. Women in depression. Women experience depression at twice the rate of men. This is a 2-to-1 ratio, exists regardless of the racial or ethnic background or economic status. Postpartum mood changes. A woman can also get depression after childbirth, if not treated right after. Depression may increase a woman's risk of broken bones. The hip bone mineral density of a woman with a history of major depression was found to be 10 to 15% lower than the normal. Economic impact of depression. Major depressive disorder is a leading cause of disability in the U.S. Major depression is a leading cause of disability worldwide, and depression's annual toll on U.S. businesses amounts to about $70 billion. Depression and suicide. Depression is the cause of over 2/3 of the 30,000 reported suicides in the U.S. For every 2 homicides committed in the United States, there are 3 suicides. Death rates from suicides, 11.3 per 100,000 population, remains higher than the death rate for chronic liver disease, Alzheimer's, homicide, and other illnesses. Relevant risk factors, prevention techniques, and components of health affected. Effects on physical health. Start with heart disease and heart attacks. Data suggests that depression itself may be a risk factor for heart disease as well as increased severity. Patients with heart disease who are depressed tend to have more severe cardiac symptoms than those who are not depressed. Obesity. People, especially adolescents who are depressed, have a high risk for obesity. Conversely, obese people are about 25% more likely than non-obese people to develop depression or other mood disorders. Mental decline. Depression in the elderly is associated with a decline in mental function regardless of the presence of dementia. Cancer. Depression does not increase the risk of cancer, but cancer can physically trigger depression by affecting chemicals in the brain. Sometimes depressive symptoms can manifest even before the cancer is diagnosed. Strategies currently utilized. Up to 80% of those treated for depression show an improvement in their symptoms generally within 4 to 6 weeks of being medicated. Despite the high treatment success rate, nearly 2 out of 3 people suffering with depression do not actively seek or receive proper treatment. Participation in a DBSA patient-to-patient support group improved treatment compliance by almost 86% and reduced inpatient hospitalization. Drug treatments. Selective serotonin reuptake inhibitors. These drugs have become a standard antidepressant. They target the brain's chemical neurotransmitter known as serotonin. They can be effective and usually have moderate side effects. Other neurotransmitter inhibitors. These drugs target neurotransmitters other than or in addition to serotonin, such as norepinephrine. Many are proving to be effective in patients who do not respond to standard antidepressants or in specific patients such as smokers who want to quit or patients with chronic pain. Tricyclic antidepressants. These drugs are effective but can have severe adverse effects, particularly in older people. Monoamine oxidase inhibitors. These drugs include newer selective MOAs or MOIs, are the most effective antidepressants for atypical depression, but have some severe side effects and require restrictive dietary rules and care to avoid drug interactions. Suicide risk antidepressant medications. In recent years, there has been concern that the selective serotonin reuptake inhibitors Antidepressants can increase the risk of suicidal behavior. Of particular concern is the greater risk for suicide in young people taking these medications. While depression is itself a major risk factor for suicide, an antidepressant medication for revitalizing suicide attempts in patients who were too despondent before treatment to make the effort, evidence suggests that in some cases the medication itself can cause suicidal thoughts and behaviors. Paroxetine appears to have the strongest association with increased suicidal risk, particularly in young adults. Psychotherapy. Cognitive behavioral therapy works as well as antidepressants in treating severe depression. Like all psychotherapies, much of the success depends on the skill of the therapist. Psychodynamic therapy and interpersonal therapy is a form of talk therapy that focuses on the uncovering internal conflicts and unresolved issues that stem from childhood. Interpersonal therapy is a form of psychodynamic therapy that acknowledges the childhood roots of depression, but focuses on the symptoms of current issues that may be causing the problems. Electroconvulsive therapy, which is known as shock treatment, is considered an effective and safe treatment for severe depression in an appropriate situation. Transcranial magnetic stimulation and deep brain stimulation. Repetitive transcranial magnetic stimulation uses high-frequency magnetic pulses that target affected areas of the brain. It is generally regarded as a second-line treatment of the shock therapy. And vagus nerve stimulation is a procedure that affects certain patients with ellipse and is now showing some success in patients with treatment-resistant depression. Phototherapy, known as light therapy, is recommended as treatment for seasonal affective disorder, particularly for patients who do not wish to use antidepressant. This procedure is non-invasive and simple. It is best performed immediately after waking up in the morning. The patient sits a few feet away from a box-like device that emits very bright fluorescent light for about 30 minutes a day. Potential alternatives to consider. Exercise, both aerobic exercise and resistance training, can help provide some improvement in mood symptoms for patients with depression. Aerobic workouts can raise chemicals in the brain, such as endorphins, adrenaline, serotonin, and dopamine that produce the so-called runner's high. Yoga practice, which involves rhythmic stretching movements and breathing, may help improve and stabilize mood. Meditation may also be helpful as well. Sleep hygiene. Patients with depression who suffer from insomnia, either as a result of a condition or medications, may be helped by learning sleep hygiene techniques. Nutrition and diet. A healthy diet and low saturated foods and rich in whole grains, fresh fruits, and vegetables is important for anyone. Patients should be sure to maintain a regular, healthy diet, particularly if they have experienced weight gain from medications. They should also try to decrease their use of alcohol and tobacco. Social support. A strong network of social support is important for both prevention and recovery from depression. Support from family and friends must, however, be healthy and positive. It is helpful for family members to become educated about depression and antidepressant medications. All in all, throughout this project, I came to realize that depression is not just an illness, it is a mental illness, and that when you're diagnosed with depression, it's something you have to deal with every day. You can't just take a medication and it goes away, like if you have the flu or something like that. Like if you have schizophrenia or ADHD or obsessive compulsive disorder, this is something that you have to work with in your daily life. You have to learn how to accept your depression, admit to being depressed, and learn how to cope with it in everyday life, which is something that we have not been able to realize, and that's why many people are afraid to come forth and admit to being depressed. And hopefully with research as it goes on, we can figure out how to accept depression instead of hiding from it. That way we can help people with depression cope and help families cope who have people suffering from depression as well. All in all, depression can affect anybody. It does not discriminate. It doesn't matter if you are healthy, young, old, sick. Anybody can fall victim to depression. It just depends on their situation, what they're going through in life at that moment.